Hi, good morning, Cassie. My name is Mihiraa. Let's start the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your roleplay.
Good morning, Mihiraa. My name is Kassy Flintoff, and I'm one of the nurses here in the pre-operative unit. It's lovely to meet you. I understand you're booked in for your lithotripsy procedure tomorrow, so I'm here to chat with you about what to expect and to go through all the preparation. That's the main reason for our visit today. But first, how are you feeling about everything?
Hello, Cassie. Honestly, I'm feeling a bit anxious. I've never had any procedure like this before. I'm not really sure what I've gotten myself into.
It's completely normal to feel anxious when facing something new, and I appreciate you telling me that. A big part of my job is to help ease those worries. So Mihiraa, let's start by talking about what lithotripsy actually is, as understanding it often makes it feel a lot less intimidating. Despite the powerful sounding name, it's actually a non-invasive procedure, which is a very good thing. We use a machine to generate focused shock waves that travel through your skin and target the kidney stone. They hit the stone and cause it to vibrate and break apart into tiny, sand-like fragments. These small pieces can then pass naturally out of your body in your urine over the following days or weeks. Because there are no cuts or incisions, it's much gentler on your body than traditional surgery. Some slight discomfort, like a mild tapping sensation or some soreness afterwards, is normal and very manageable, but you won't feel any sharp surgical pain. What thoughts are going through your mind after hearing that?
That does make me feel a little better. I can handle some discomfort, I think. But what do I need to do to get ready for it? Is there anything special I must do today or tonight?
Yes, that's exactly right. It's all done from the outside. I'm glad that's a bit clearer. Now, to answer your question about getting ready, Mihiraa, let's move on to the pre-operative instructions. This part is very important for your safety. You must avoid all food and drink, including water, for 6 hours before your procedure. This ensures your stomach is empty for the anesthesia. For example, if you're scheduled for 8 a.m., you shouldn't eat or drink anything after 2 a.m. tonight. Now, when you arrive at the hospital tomorrow, the preparation here will involve us getting you settled, and we'll also discuss the anesthesia. You won't be fully unconscious. Instead, you'll be given a light sedation through a small tube in your vein. This will make you feel very relaxed and drowsy, so you won't be aware of the procedure, but you won't be as deeply asleep as with a general anesthetic. It makes for a much gentler waking up experience. Do you have any questions or concerns?
No, that's very clear. I'll set an alarm on my phone so I remember not to have my early morning tea. It sounds straightforward. But what happens during the procedure itself? Will I feel anything?
That's a very practical approach. So, let's talk about exactly that. What to expect during the procedure. Mihiraa, it usually takes about 45 to 60 minutes. You'll be asked to lie on a soft, water-filled cushion, which is part of the machine. This cushion helps transmit the shock waves effectively. Because of the sedation, you'll be very comfortable. You might be aware of a faint tapping or flicking sensation against your skin, but it's rarely described as painful, more just as an odd feeling. The most important thing for you to do is just lie still and relax. The team will be with you the whole time, monitoring you closely. Afterwards, it's also normal to notice some things that might seem a little alarming if you're not prepared. You may see blood in your urine for a few days, giving it a pinkish tinge, which is completely expected. You might also have some bruising on your back or abdomen and some mild, manageable pain. Now, after you're discharged, it's crucial that a family member or friend comes to pick you up and stays with you for the first 24 hours. Also, because of the sedation, you must not drive, operate machinery, or make any important legal decisions for 24 hours. Mihiraa, do you have someone who can support you and bring you home?
Yes, my daughter is taking the day off work to be with me. She'll drive me and stay overnight. Is there anything I should watch out for that would mean I need to call for help?
Having your daughter there is wonderful, Mihiraa. That leads perfectly into my last point, which is knowing when to contact medical staff after you're home. While some discomfort is expected, you should call us or seek emergency care immediately if you experience any of these signs. Severe pain that is not relieved by the pain medication will give you. A fever or chills, which could signal an infection. If you find you are unable to pass urine at all, or if you notice you're passing large clots or have heavy, frank bleeding that doesn't clear after resting and drinking fluids. These are not expected and need a doctor's attention. Do any of these things worry you, or do you have any other concerns on your mind?
No, I think you've covered everything. The only thing that worried me was missing a danger sign, but those are very clear. I'll keep this list handy. Thank you for being so patient, Kassy. I feel much calmer now.
You're so welcome, Mihiraa. I'm glad you feel more at ease. Let me just quickly summarize our whole discussion for your clarity. We confirmed that you're here for pre-operative education for your lithotripsy tomorrow, a non-invasive procedure using shock waves to break up your kidney stone. We went over the preparation, nothing to eat or drink for 6 hours beforehand, and that you'll receive light sedation here. We discussed that the procedure takes under an hour, with you lying on a soft cushion, and that afterwards, blood and urine, bruising, and mild pain are normal. We stressed that your daughter will be with you post-discharge, and you won't be driving for 24 hours. Finally, we reviewed the clear reasons to call for help: unrelieved severe pain, fever or chills, inability to pass urine, or large clots. You're fully prepared. Do you feel ready to go ahead?
Absolutely. I know exactly what's happening now. Thank you so much, Kassy.
It was my pleasure. The team will take excellent care of you tomorrow, Mihiraa. All the best.